evening, everyone. Welcome to Solh Talks. Today we have with us Ms. Jyoti Dadlani. Ms. Dadlani is a psychologist and POSH enabler, founder of Cerebeto Vocational Planet, winner of Dada Saheb Phalke Cine and Social Awards, and an author of the book I Am Perfect Too. We welcome you, ma'am, on the show.
Thank you so much.
So, ma'am, as we all know that today is the World Health Day, and initially we have been talking about health in all aspects, but generally the mental health aspect is what it is lacking behind. We had other, various esteemed speakers with us who were just talking about inclusion of mental health in our system, and we just wanted to ask you that there have been talks that a universal health coverage which should include a mental health aspect as well. We are so you've been invited here for this on this to speak on this. So ma'am, as we all know that there's a universal health coverage which ensures to access quality and affordable care for mental health when it comes to mental health, and they have a target to achieve it by 2023. So, what is the progress so far, ma'am, on UHC, and where are we achieving by 2023 globally?
Globally. So in the recent year, there has been increasing knowledge about the role of important people are openly talking up. Not only people, the influential, the celebrities have come up and discussing their mental health that encourage other. It is normal.
Right.
So, going in a depression does not mean I'm totally gone mad and I cannot approach. I'm still approachable. And this is normal condition. In a lifetime, it happened to each and every one.
Right.
And since the depression is a largest, leading cause of disability, second is suicidal. So there's a high rate between 15 to 29 years of old, and people with several medical condition is prematurely the condition of death is premature compared to all the others conditions. So mental health needs to be taken very seriously despite of progressing countries.
Right.
People with mental health, we in our country we have a special mental health people different rights as per the law and different rights for that, but then the condition is how many people are even aware on it.
Right.
And how many people are utilizing it, that's a different question marker together. And still there is a stigma, then still there are discrimination. So all this happening, and effectivity of treatment coverage is extremely low. So whenever we are saying, insurance, even as a mental health professional, we were very happy to say, mental health coverage has been included in your normal insurance also, or your medical also. But that's also, your normal anxiety and depression won't be covered in that.
Absolutely true.
So whatever I'm facing daily, until unless it's not extreme, it's not going to be covered. So then how we are actually covering, and people are taking that it's okay to take a break, but then if I take a break, who's if I'm a daily worker or my family runs on me, who gonna earn for me?
Right.
So increasing investment in all fronts, mental health awareness needs to be understand, reduce the stigma, and more accessible. And I appreciate that who is specially initiative for mental health 2019-2023 universal health coverage, which are ensuring that all access of quality and affordable care.
Right.
Condition is affordable. If you see within India, there you might be having a small hospitals. We have smallest to smallest government, private, and then dependent. The aspect is you will get their psychiatrist, you will get psychologists when you are in a severe condition. And is there any special department of mental health who just take care of mental health? So those are very few.
Absolutely, ma'am.
So those accessibility is not itself there. So you cannot put the one normal patient and mental patient in one bed. People don't do that.
Right.
So somewhere even as a healthcare industry also needs to give like when the COVID hit, you make a space for it, right?
Right.
So why not a mental space for mental health care? I mean, why not?
Right.
Those patients might not might be not that serious as other patient. They're just as normal as you and me can be, but still have anxiety, depression. Why not do that?
No, 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 ma'am. Well, very well said. I agree to you, ma'am, because I've seen actually, people not treating them a part of the society, and then they consider them to be a burden on them. They think that, if they have a depression or schizophrenia or any psychotic disorder, it is communicable. So they say, ki, agar we touch them, so probably, they'll also face the same problems.
Hmm.
This is a very sad state in India. I think not in India, but I think globally. But the infrastructure and, as you said, the lack of awareness and the lack of system, the hospital care system, everything has to be taken care of. So, ma'am, generally, this with this year budget also, it has been said that there would be mental health inclusion that would be there. So, what progress have we made till far on integration of mental health into the mental health system in India?
So, so now the way we have HIV, we have gender-based violence, suicidal prevention, everything. So that has been taken care, and rights of of people receiving that care, quality rights has been introduced. Mental health policy litigations has been changed, and luckily, not only by the legal but also corporates are taking a lot of efforts for their employees, making sure that they're giving their bit for their employees mental health. I think that is a big initiative that we have seen within last 2 years.
Okay.
Huh? Because see, how often if you get fever we will immediately go to the doctor.
Right, right.
And now so if we get fever we immediately take out the COVID test and we do it. But any small things we do not hesitate, but when we ask someone to visit a counselor or any kind of mental health professional, uh, it is just stepping back. Arey chal raha hai na,
Right.
let it be.
This too shall pass. हो जाएगा ठीक.
This phase to pass. This might be just for certain time being, and then I was just gonna vent out or gonna have some beer, and I will be fine. So that is we are still hesitate. So when someone else do it for us, like the corporates are doing and other health sectors are doing, at least people are okay.
Right.
I will go and attain. At least I'm not individually target. I'm in a group, so I'm in a safer phase, and no one is going to point out that I have some problem.
True, true.
Huh. So somewhere, India, these kind of small initiative, the psychological support by humanitarians provided, it is making a lot of interventions. Mental health at workplace, mental health at economics, mental health at children, abroad. I think there are a lot of things are changing in India, and it is definitely people are openly talking about it, accepting it, and approaching. That is a good part of it.
Right, ma'am. Now, because we see that on social media also, people are coming up, the mental health professionals have come up, they're speaking to them, taking pro bono sessions, support groups are there. So, yeah, a lot of being is done right now. And I think by the 2023, we can achieve more progress in it.
Very true, very true.
Yes, ma'am. So, ma'am, apart from not just extending coverage, but rethinking, how is mental health care delivered and moving towards the community based and preventive models? Because we have seen in the community, it is not reaching to the people, especially in the rural areas. So, how is it working, ma'am?
Okay. So let's say if I tell you a simplest example, even the rural area, urban area, everyone has a mobile,
Right.
right? And as you say, there are so many mental health speakers who actually giving. They are there on Instagram, they are there on Facebook, they are on every social media which is giving daily awareness, daily solution for your daily problems.
Right.
And they are specifically mentioning if you have a serious problem, get on a PM or DM. So at least that daily practices they're definitely giving. So somewhere even in a small amount, the changes are happening.
Right.
So if you tell even in the rural area, urban area, if you tell people, sit, I'm going to give you a lecture, they will not do this.
True.
Uh, as per the human capacity, we are now moving from 3 hours movie to binge watching. Yeah, where 15 minutes is more than enough. So, similarly, if we are giving through anything which is through media and we are able to reach, ultimate is a reach, right?
Right,
And
right,
that is being done. Wonderful. And people are, as you said, support groups are very, very active.
right,
Where people are more comfortable wherever they are not targeted alone.
right, right.
Hmm. So,
Yeah,
and then there are certain communities where people actually go as the anonymous, ask their problem, and there are hundred of kind of comments and feedback they get. You should do that. I have been so when people say I have been in the same situation, I immediately connect.
true,
They don't know might each other doesn't matter. So the
right,
moment the people feel they are hurt, they start to heal.
right, right, ma'am. Yeah, because this rapport building and empathy, this is what connects people. I think it is with human beings also. It's a very natural thing.
Hmm.
True, true, ma'am. So, ma'am, that all of us we know that you are an POSH expert. So, we would like you to tell us what does a POSH expert do, and how do you actually enlighten and actually tell us that how can you improve the workplace mental health conditions?
Okay, so POSH full form is prevention of sexual harassment.
Okay.
Along with that, I'm a psychologist. Okay, so when these combos come, it's like a blessing for them. First, it's more than mental health stigma. There is a stigma about POSH.
Right,
So even the harassment happened, it hardly being reported because सबसे बड़ा लोग क्या कहेंगे रोग.
right, right.
So somewhere people are still hesitate,
Huh.
and uh, most of the harassment cases are being reported because when we notice in those small surveys, we see it is more on the frustration part of it.
Okay.
Frustration of non-fulfillment desires,
Mm-hmm.
frustration of not being heard, and then not being valued.
Mm-hmm.
So somewhere, if we take consider all of it, I think it when we create awareness for sexual harassment, we also tell that what kind of personalities and what kind of behavior you look forward at. If you consider, for the harassment, what kind of behaviors consider not against the harassment.
Right, right, right.
So then people watch out. Okay, what I'm supposed to do and what I'm supposed to do if I'm feeling certain way.
Mm-hmm.
So there are always, there are committee in every company which is need to be formed. So if you
Right.
have any kind of problem, they are always approachable for you.
Mm-hmm.
And this is a part of compliance, which is a compulsory part.
Okay.
So people are there. In fact, if someone is going through any kind of sexual harassment, both a reporter, and the accuser or a respondent, both are entitled to get a counseling services that can be provided by the company.
Okay.
So these are wonderful, initiatives which is already existent and it is given by government of India.
Oh.
Yes, so it is very nice to have this kind of, alarming schedules. Then not every employee needs for the same. Offering some mental health days off. There is a concept of sad day off.
Okay.
Huh. So it's just simple, I'm too overwhelmed. I have experienced maybe occupational burnout. I just want to take day off, which is okay. You're there is a concept. You can actually take a sad day off in your organization. So go ahead.
Yeah. That's nice. I've never heard of it. Initially, we have heard that Zomato just introduced, off during the menstruation days. So yeah, but then this sad day, I think it's really, it was good. Yeah, we never knew of this. It's just you can just take a sad day off.
Yes,
True.
you can, because menstruation day is again the woman oriented. Then
Right,
there is
right,
gender biasness happening.
right, right, right.
So sadness can be definitely taken by anyone.
Yeah, yeah. No, it is very good that corporates are actually doing a lot of to for the well-being of the employees. And actually, they plan so many days and events just to make them feel refreshed. Right. So, ma'am, coming back to the universal health coverage, according to you, why have countries failed to achieve universal mental health coverages globally?
Uh, it's not they don't want to, but then also require that kind of infrastructure.
Hmm.
Uh, that kind of facilities and those kind of experts.
Right.
Okay. And now in even our country also, in a kind of mental health, you will find healers, you will find doctors, you will find every single category, right?
True.
And so it's very debatable aspect, which where I am supposed to go. I don't want it to get diagnosed. Okay, I just wanted to get alternative therapies. It's up to the personal choice, but it does a permanent solution. It's not my position to comment because it's very debatable topic. But when it comes around universal health coverage kind of stuff, where you require those kind of experts, certified expert, I would say, uh, and it requires strong alliance with the private sector.
Okay.
Alliance with the insurance company, medical association, pharmaceutical company, everyone has to come together and come up with the aid that something can be provided to the mental health ground. Finally, because sometimes with the high prices, privatization, even if the normal that low income cannot go and afford it.
Right.
Yeah. And the level, so I was working with one of the government hospitals, and then we used to see huge people, especially with schizophrenia, disorders, addictions, everything. And you see, so there are, since it was a government hospital, so there is one category only. You will see very low income people will walk in because they think it's very affordable. And the surprise was more than 100 people cases per doctor. Can you see understand the ratio?
Absolutely, absolutely, ma'am.
So so that way, because of, if they knows, if I go to privatization, my cost will be huge,
High.
very
Right.
high.
Right.
I think somewhere, if you can come up with a negotiation, come up with such a term which is can be affordable to
Right.
even each and everyone, I think that will be really helpful.
Yeah, like a neutral system. I mean, yeah. So it would be same for everyone. I hope with this inclusion of the bill that has been passed, when they say the mental health coverage, I think they should be doing it. But yes,
Looking forward, if something can help, that will really help a lot of people. And the simplest, even the anxiety should cover.
right.
Yeah. So my anxiety, in that case, my anxiety should not get to my disorders.
True. Absolutely true, ma'am.
For what we work for, we work for securities, right? If I know my health insurance is gonna cover my mental health also, I'm secure somewhere.
Right, absolutely. Because there's no health, like mental health, because that is the utmost thing in the human body.
Absolutely, very true.
Yes, ma'am. And ma'am, so what is the most important step which has to be taken right now? The utmost priority to integrate mental health into the universal health coverage.
I think USC must do integrating properly, so all services come together, and primary care package should include the mental health services.
Okay, okay, ma'am. And ma'am, why do you think that universal health coverage should include mental health part in it? Like, what is the need, and what is the globally? If we speak globally, why is it important, ma'am?
Okay, so first of all, we have to start treating mental health is as a physical health. Okay, so why we require a physical health? Because sometimes together expenses is not really possible, even the salaried person or a professional like us. So
Right.
that's the reason we take of the health coverage, that even in my bad days, those should cover me. So similarly for mental health, because COVID has been tossed, last 2 years has been tossed for a lot of people. Loss of loved one, grief counseling, loss of job, everything is, my lifestyle has been gone out down. Even we are out now, luckily we are mask free,
Huh.
but there are still people who's wondering, and I can see people with the mask because they're, now it's become habit.
Absolutely.
So if mask is not there, something is missing, and secondly, I'm really scared.
Right.
So somewhere, if I'm scared, worried about my physical health, and that's the reason I'm getting a kind of insurance or coverage, medical coverage. So similarly for mental health, right?
Right, ma'am.
Huh. And secondly, then 100 times I don't need to think I should approach or not, because my hesitation start the moment I start thinking, oh my god, now what people say, I'm gonna go to, go to.
No, 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 absolutely true, ma'am. Because as you said, COVID has actually taken a toss on our lives, and because of I think the COVID, mental health awareness also started. It just shoot up. Like so people were just spoke about mental health awareness and everything. So people, the insecurity I think has been built in the minds of the people right now, right? So because and I think because of this insecurity, people they tend to overthink, and thus it leads to the start of mental health issues.
Very true.
Right. So, ma'am, as an expert, what strategies will you apply to inculcate, or whatever will be your opinions, your strategies that you may actually advise to everyone to inculcate mental health in our ecosystem?
So I strongly believe if you wanted to change anything, first, start with yourself.
Absolutely.
And as a human being, we play different role. We are someone's son, we are someone's wife, daughter, mother, chacha, chachi. My God, our roles are not ending. We're sometimes a boss, we're sometimes an employee, reportees, reporter, whatever. The point is, if in this process we actually forget what we are really. So I often ask this question to all my clients: what is your hobby? And you know what, this kind of hobbies are okay, I'm watching Netflix become a hobby. Binging on a TV become a hobby, or chit chatting become a hobby. When was that started? So they are not even aware that what they used to enjoy for themselves. Sometimes, spending a time with my family become a hobby. But what about you as an individual? And the answer is they will go blank for 10 minutes. It's like we never thought about it.
True.
Somewhere you have to start with your self-care first. If you wanted to make everyone happy in the world, start with your own happiness.
Own happiness. Absolutely.
So until and unless you're not satisfied, you're not content, you don't expect anyone else.
Right, ma'am.
Then it's like a broken shell, you're completely broken from inside, but from outside you wanted to make up everything happy. That does not work for a long time.
Right.
Eventually gonna break down very badly.
Right. And ma'am, apart from this, what else do you think that there should be there in the mental health coverage?
Apart from that, I think mental health coverage, it's not only important to have a coverage, but educate the people about it. Okay, there is a coverage the way we educate about all other disease, so please educate about mental disease also. So they know ki, okay, you know what, I'm at least covered, I'm aware.
Right.
Mm. I think that will be great if you can even able to create that awareness. Even a single person who's not educated like us,
Right.
that person should know, okay, you know what, mera health insurance hai, I'm sorted.
Right. Right. Yeah. So I just wish and hope, ma'am, that the greener days are closing. I mean, that
Very
should be
true.
here very soon, and
Very true.
people should actually, start seeking mental health help, help from the professionals, and just not sit back and just overthink. There is something wrong with me, and there's definitely something wrong with me, and I should not go. So yeah. So, ma'am, before coming to the end of the session, what would be your message to our audience, ma'am?
uh, Instead of overthinking, just live the life. Yeah, I mean, we try to make it so complicated matters, which is not really.
Right.
Every time we have to control the things. If the things doesn't go in my way, then it's a problematic. Whatever you have, try to be happy in that. No, try to be contained.
Right, right, ma'am. So, ma'am, how do you actually, if I want to ask you some questions, how would you actually kill, how do you actually, what are your favorite hobbies? Like you just said that you spoke to a client of yours and he said that his favorite hobby is watching Netflix. How about you, ma'am?
Okay, my hobbies are I'm an explorer. Okay, and
Okay.
So it's not only about traveling, but if I find something genuine, I simply go and ask the person, you know what, I think you have a knowledge, and why don't you tell me about? And today, when I was in a lecture, surprisingly, I heard about someone, come up with excellent idea. They were doing simple report writing, and they were just first year students,
Uh-huh.
and they come up with an excellent idea. So actually, I sat with them and I understand why. You know what? This is the liberalization me also. So
Right.
teach me. So never get offended for asking questions.
Uh-huh.
But if you want to learn something, go ahead, shoot it.
Right, right. Because learning has no age. You keep on
Yes,
learning from the day you're born till the day you die. So learning is an everyday process.
very true.
Right, right. So thank you, ma'am. It was really wonderful having you here to
Thank you so
speak on
much.
universal health coverage. I hope this thing, whatever we just spoke and whatever we just discussed, things should actually be taken care into consideration. And we look forward having you here with us again, ma'am.
Thank you so much.
Thank you, ma'am.
Yeah, bye.
Bye.